from blood into the tissues. On the other way, in clinical term, we said edema. So when filtration increase, it means edema in any tissues is happen. So some situations and example. Somebody has a malnutrition, has a no high protein diet. This oncotic pressure is because of protein, yes, remember? So what happens if some people, for example, African people, has a low protein diet. So they have a low protein diet, the amount of proteins decrease, the oncotic pressure of blood decrease, so the whole pressures tend to be more filtration. It means edema. Do you see that kids in the Africa with a big stomach, I said that the abdomen part has a low resistance, so we can keep a large amount of fluids in the abdomen. And the hand and legs are so tiny and fragile because there is no protein to making skeletal muscles. And on the other hand, the filtration rate is high in that patient, in that kids, and they have edema in their body, especially in the abdomen. Another case, some of you asked me about some kidney failure. In the kidney failure, what happened? The kidney cannot absorb important part, especially proteins. It means that the fenestra, do you remember the fenestra? Last hour we talked fenestra on the surface of endothelial cells. The fenestra are getting enlarged because of infection or because of any toxins effect. The fenestra enlarge, so most of proteins are exerted from body. It means most of protein are seen in the urea. In that case, in many kidney failure, we have proteinuria, protein inside the urea. It means that the blood protein level decrease. It means that the oncotic pressure of blood decrease, and the edema is happen. The force is mostly, the pressure is mostly on the filtration, so most of blood are passing into the tissues, and edema is happen in that case, for example. So we have another disease that we can largely see this general edema, liver disease, liver fibrosis or liver cirrhosis, the fatty liver. All of these diseases which related to liver, it means that from GI tract you will see that the liver is the center of protein production in our body. The proteins always produced in the liver. So in some disease such as liver fibrosis or fatty liver cannot produce enough protein. Liver cannot produce enough protein. What happened again? You tell me based on this filtration. Oncotic pressure of blood reduce, the filtration increase, so edema is happen in that cases again. So we are seeing many related disease like edema, which the filtration, like liver or kidney disease, which filtration increase, edema is seen in that patients. The whole general edema in the whole body, okay? So if somebody refers to you for the edema, at the first stage, you have to see that the edema is general or local. In the one hand, they have edema, or generally they have edema, okay? If general, they have edema, you can be sure that there is a problem in liver, kidney, or we discussed in the heart failure. In the heart failure, we discussed that. You have to see that we are problem in these organs. But in the local edema, what is the cause of local edema? What do you think? Do you know the meaning of edema? Yes. Filtration increase. Okay? So what is the cause of local edema? What do you think?
Protein is in the muscles.
The aortic pressure of the liver is decreased, so it can maybe cause edema.
Blocking, for example, veins. For one infection or for one anatomical thing, the veins block. The veins of hand block. So the blood cannot proper, so blood trap in the one hand or one leg. So we have local edema. So in the first stage, you have to check the edema for the local or general.
Should we take monitor?
Take
Monitor to treat edema.
take protein, drop, yes, obviously. In the malnutrition, they should put protein in the diet. In the kidney disease, they should do some treatment for the infection of kidney, okay? So in the liver disease, we have a drug to reduce liver's fatty acid or liver's fibrosis. In the liver, we have fatty acid, the first stage, liver fibrosis and liver cirrhosis. Liver fatty acid and liver fibrosis, we can treat it by drug. But if liver reach to the third stage, that is the cirrhosis of liver, we cannot treat it. It means liver is out of work.
What does KF mean?
I will tell you. I will tell you. So, your friend came to the board and used this formula. This formula, based on the pressures, hydrostatic pressure or colloid pressure, is the same. So, if you want, you can use this formula, or if you don't want, you can find the filtration pressure, reduce it from absorption pressure, reabsorption pressures. Okay, both of them are the same. It means summation of the whole pressures. In here, my dear friend, you are seeing this pressure summation, and this pressure summation is multiplied into the Kf. Kf means filtration coefficient. Filtration coefficient, we discussed about different permeability of endothelial cells, yes? Different permeability of endothelial cells. This coefficient of filtration related to that. For example, in the final exam, if I want to calculate, for example, this filtration rate, I will give you Kf. I will give you, for example, Kf is near to, for example, 0.001. 0.001 belongs to moderate permeable, such as kidney, or 0.00001 belongs to continuous type of vessels, such as type of endothelial cells, such as brain capillaries. Okay, we have different Kf based on permeability. So, most important protein, please pay attention, most important protein that makes colloid pressure, that I told you how it's important, is these proteins. My dear friend, albumin, globulin, fibrinogen, mostly albumin. Most important protein for colloid pressure in the blood is albumin. And let's let's show you the question. you find the answer? You are seeing hydrostatic and colloid pressures.
Doctor, can you send me this file for the
Just send
questions?
it as a question.
Send it?
Yes, yesterday I sent it to
It's the same file?
Yes, questions. questions PPT.
That's fine.
Yes.
Okay.
So, what is the answer? D. Volunteer to come to the board. Thank you. Thank you. Please clap yourself. All of you agree with the answer?
Yes.
150. Isn't it easy? We have same type of questions in any topics, in any type of exams for the simulatory part. Please think about this question. The patient take a drug that decrease diameter of artery. No, in the experiment. In the experiment, they decrease diameter of arterioles in animals. What do you think about this? My friends, conductance, please pay attention to this. Maybe I didn't tell you this. Conductance is reversal resistance. So the formula of conductance is this. Conductance is 1 to the resistance. resistance. Conductance is how the vessels can pass the blood. Okay? Can pass the blood. Is the opposite of resistance. Decrease the diameter, decrease. Okay? Who said A? D? E? Decrease the diameter, decrease. It means vasodilation. Decrease the diameter. No, sorry. I'm mistake. I was mistake. Decrease the diameter is vasoconstriction. Yes, sorry. So decrease the diameter, conductance decrease, filtration decrease, and blood flow decrease. Yes, you are right. The E. All of you agree with E? Yes. All of them decrease. Yes.
Why you choose
D?
E? Why you choose it?
Why? Because conductance increase, decrease, because the resistance increase, okay? And capillary filtration reduce. Why capillary filtration reduce? Because blood flow reduce. So blood flow reduce, it means blood pressure reduce based on Ohm's law. So pressure of hydrostatic of capillaries decrease.
And the resistance had decreased and
Resistance increase.
no, why? Because the blood flow increased, the resistance decreased. So when the resistance decreased, it should be increased.
The decrease of arterioles diameter, it means radius. When radius decrease, we know that resistance increase. Resistance increase, conductance decrease. Okay? So when the resistance increase, blood flow decrease. Blood flow decrease, it means the blood that pass in the capillaries decrease. Okay? The blood passing in the capillaries decrease, it means blood pressure decrease. Pressure and flow are the same direction. Pressure decrease, it means The pressure of the filtration force decrease. The filtration. And what will decrease?
So the direction of the pressure is the same of the filtration,
Yes, yes.
or the opposite of reabsorption?
Yes. Any question? No? Can you find the answer of this one to me? Which of them cause decreased capillary filtration? B. B. Agree with me? Yes. Because as my dear friend, you are talking so much. Okay. So as you are seeing here, we should find an option with increased reabsorption. Yes, against filtration. Only colloid osmotic pressure is against filtration. All of them are in the filtration. So, one topic remains, the lymphatic system. We can continue and finish it 11:30, or you can go to the rest and after that. Which one? Rest? Who need rest? Raise your hand. Who needs rest? Who said we can continue? What about others? You have no idea? You are flexible with all scenarios. Okay, let's have a rest. For only promise me please back to the class after 15 minutes, okay?